Good morning, everyone. I'm Serene, one of the scholarship officers with Healthcare Scholarships and Talent. To start off, welcome to the final day of the Healthcare Scholarships Virtual Experience 2021. For those who have been attending the earlier sessions, welcome again and thank you for joining us. Welcome to Make a Difference in Community Care, Home-Based Care, St. Luke ElderCare on 3rd of March. This St. Luke ElderCare will be sharing on the home-based care delivery in community care. Home-based care allows them to reach out to seniors who have challenges accessing services in the community. This continuity of care is especially important for seniors who require further care after being discharged from a hospital. In today's session, St. Luke ElderCare will be sharing on the career experiences by a community nurse, physiotherapist, occupational therapist, and medical social worker. They will have panel dialogues and Q&A sessions with the participants. So before we begin, I have a few housekeeping rules. So firstly, if you do have any questions for our speakers, please feel free to type in your questions into the Q&A function. Kindly do note that comments will go into the chat functions and questions will go into the Q&A function. So if you would like to direct your question to a specific speaker, please kindly indicate it into the question. And if you see a question that you're interested in being answered, please upvote those questions. So we do have a time for Q&A at the end of the session, so please stay tuned till then. Secondly, we do have an ongoing leaderboard and contest section for participants to win attractive prizes such as Universal Studios Singapore one-day pass, Disney Plus subscription, GrabFood vouchers, and many more. So now I would like to pass on the time to Lei Ling. Ms. Lei Ling, please.
Okay. Hi, everyone. Very good morning. Thank you for joining us in this virtual understanding of what is called rehab in the with St. Luke's ElderCare. I feel so funny, right? Like I'm talking to like a screen. We can't see you guys. Okay. First of all, to start with, I just want to thank MOHH and AIC for having St. Luke's ElderCare on board here to share on our services and our journey, especially the community service in home care. Okay, self-introduction, I'm Lei Ling. Okay, but before that, maybe I should share slides with you too. Okay, let me just share screen on our slide. Okay, so welcome everyone again. Yep, I'm Lei Ling, and I'm the head of St. Luke's ElderCare residence at Ang-Mo-Kio. So just some background, I'm a physiotherapist by training. I graduated some 30 years ago, and I've been with St. Luke's for the last 18 years, but I've been in the community sector for the last about 21 years. So, you know, in my journey in the community, it is really, really exciting. I stay put for this long because I really see the value and the allied health professionals and the nursing team, the value of us serving the elders, especially in the community, because we partner with them in their journey back to their home where they are most comfortable with. Okay, so this entire sharing is to just encourage all of you to consider the community sector if you are keen to look at in the healthcare sector. Yeah. Okay, so today from my part, I'll be sharing with you of my organization, St. Luke's ElderCare, you know, what we provide in the community and our philosophy of care. Then we will proceed on to share with you on the home care service, and my colleagues will then share with you their experience. Okay, St. Luke's ElderCare, we are a Christian healthcare provider, you know, wanting to enrich the lives in the communities. So enriching lives is not just our elders, but our colleagues, our volunteers, you know, people, our stakeholders. Okay, we we aim to transform how care is provided in the community. And with that, we use our Grace model of care to reach out to all the people, the touch point that we have with people in the community. Okay. These are our services. I understand that this is already like the final day of sharing of community services. So I hope by today, many of you who have attended the different provider sharing have already heard all these very common terms that we use in the community, the different types of services that we have. Okay, so likewise for St. Luke, we are considered a provider that has integrated service to support the people in the community, especially the elders. We are specializing in the elder sector. Okay, so we run this 4 different pillar of service, and the first one will be our center-based services. Okay, when someone is discharged from the hospital or couldn't stay at home for whatever reason, you know, maybe they need more engagement in the day, they actually comes to our center-based services. So center-based is just open from, it's just like a childcare. Opening hours is from morning to evening. We provide transport to bring them into our center-based services. And what can be run in a center? You know, we have rehab services, so they can come in for their physiotherapy, for their occupational therapy service. Then we run daycare service, just like they come in the morning, they go back in the evening, they are engaged by our nurses and our care staff to maintain them, to give them activities in the day so that they are not left alone, not doing anything at home. We provide meals in the center. So these are our day services, daycare. Daycare services, we provide very common types of elders that we are seeing are the dementia, elders with dementia, or elders with stroke. These are the very 2 big populations that we are seeing. Or sometimes they may be frequent fallers, and then they have to be taken care of in the day, but in the evening, they go back home to rest, stay in their own home. Their families is taking care of them. Okay. We also provide under center-based service, weekend respite. So some families, they can take care of their elders in the day, in the weekdays, but on weekends, maybe their caregiver is having to have some rest, or even the, when they need rest, they can actually send their loved ones to our weekend respite, meaning that the elders only come to the center maybe on a Saturday or on a Sunday. Then we help take care of them while the caregiver can have a breather. Okay. We also provide center-based nursing. So our nurses will stay put in the center, and then this is for people who stays very nearby. Instead of queuing up in the polyclinic, instead of seeing different healthcare providers, they actually can receive their nursing care in our centers. Things like wound dressing, things like the nasal gastro tube change, the feeding tube change, you know, and then of course this is classified as center-based services. Then we also provide home-based services. Home-based services are basically for elders who really cannot get out of their home due to either mobility or lack of caregiver that can bring them out. Then our home-based team, either the physiotherapists, the occupational therapists, our nurses, our doctors, and even our care staff will actually enter into the home to provide a suite of services to care for them, be it simple housekeeping, be it just showering, or it may be medication management, it may be physical exercise to help them to gain more mobility so that they can get out to our center-based services. So hope that from here you can see some link between the community service. It is actually a suite of services so that they can be supported at different phases of their recovering journey, and it is integrated. So if after the home-based service, we can promote their mobility, we will send them to our center-based services, you know, to use the center-based where there's more friends around them that can support them. There's a social network. Yeah. Of course, we also do community. We also provide community-based service. We have a wellness kampong in Yishun right now. Okay, this concept of community-based service is actually to reach out to the better seniors, to the well seniors, to promote healthy and graceful living, so that they can be prepared as they move on into their more golden years. Okay, so Active Aging Hub is the new term that you may be hearing in the near future, or is coming, or you have already been hearing about it. So this word Active Aging Hub is really one of the big drive in the community sector now, that many of the providers will be having to play a role to encourage active aging in our community for the well seniors. So we don't want to have a reactive model, we want to have a maintenance, a preventive model to promote good health. So that is our community-based services, the outreach. And then, of course, last but not least, St. Luke's ElderCare also provide residential-based services. And this is basically our nursing home. So we have our first nursing home at Ang Mo Kio, and I'm heading this place. It's a 9-story building. If you're interested, if ever you one day, want to volunteer, reach out to us. Even if you did not take up the scholarship or whatever, at least you know that there's community service out there that reaches out to the elders, that provide a range of services for them to help them age meaningfully in the community that they live in. Okay, this is what just an overview of what St. Luke's provides. Okay, just to share with you our history and milestone. In a very short period from 1999 to 2020, you can see that, we started back then at about 1999, we have our hospital, St. Luke's Hospital, together with the community partners, came together to set up services for St. Luke's ElderCare. Okay, and in 2001, we actually have 4 daycare centers spread island-wide, north, south, east, west. Okay, so that we can reach out to the different groups of elders in the different part of Singapore. And you can see that this is really a sunrise industry. It is going to just get more exciting as we move on in the years, because we are going to see more and more seniors coming in, more and more seniors aging in Singapore. So with this, right, you will see more services coming up. And there's a lot more that we can do for our seniors, our loved ones, when they age. Okay, you can see, there's a very drastic increase in our number of centers. It took us about 5 years to reach 11 centers, but in another 10 years, we reached from 11 centers to our 23 centers right now. Plus a nursing home, which was set up last year. And then we will have our Active Aging Hub official one this year, mid this year. Okay, so you can see that we are still growing. We are still having more nursing homes, more Active Aging Hubs will be coming under our care. Okay, this is just a very quick view of where we are. So if you intend to take up the scholarship, intend to do nursing, therapy, medical social work, then you may find a center, a place that is near you, no matter where you are staying. So this is our locations, really island-wide. Okay, just quickly share with you on our philosophy of care, so you have a better understanding of how we wanted to care for our elders. Basically, all the staff in all the services, whether we are residential-based service, whether we are center-based, whether we belong to the home-based service or taking care of the community, our philosophy of care revolves around these 5 words: graceful aging, respect, autonomy, choice, and empowerment. Okay, so what we mean by graceful aging? Okay, whatever we do in graceful aging, we wanted to embrace our seniors, our elders' weaknesses, and optimize their potential. Okay, so you can see that even if they can't cycle, we'll bring them around, letting them feel the air in their hair through our Cycle Without Age program. We have this trishaw that moves around that can take residents. So it can be our home care elders if we are able to get them out of the house. It can be our nursing home residents who hardly get out of the nursing home. They can participate in this so that they still can be out in the community, right? Of course, at St. Luke's, one of the major themes that we do is really art program. So we have our own in-house art therapists that will engage our elders to develop new interests or to enhance the skills that they already have. You know, many of them are actually very, very creative, and we believe that everyone is a creator. We can create, we can build things, and this is we are using art therapy to work this into our elders' life again. Okay, graceful aging. We respect all our elders. We love them for who they are. Okay, so when our therapies, our MSW, if they enter the home, goes into the home of our elders, you know, it is important to know these elders that we are serving and know their culture, know their religion, know their past, know them as a person, not knowing them as that case with a wound, you know, a leg wound, or don't even know the name sometimes, you know, when people talk about the elders that they serve, they may even just say, oh, the one in block 623, you know, the one that scream a lot. So these are all very negative, but we do not want that. So at St. Luke's ElderCare, our language is very important. We make sure that our staff has to know and genuinely want to know the history. Who is this elder? This elder is really somebody, even though they may be having dementia right now, they may not be behaving the same way as they used to be. They may not be socially engaging, but this is really just the disease taking over. But deep within them, they are someone and they're somebody. And so we really have to understand all our elders and who they are, and from there we can serve them better. So in the community, this is the advantage I feel personally that we have, because we get to know them better, we get to know them deeper. This is also the sense of achievement that many of our community colleagues serving the community actually feels. You know, that is really a bonding with the people that we serve. Okay, of course, we practice this thing, you know, as elders, when they age, right? Many of us will like take over their roles, you know, tell them what is best for them. Over at St. Luke's, we do not do this. We try to, when they ask for things, yes, it's almost like we try to say yes to them almost all the time. Even if cannot be a true yes, it will be like a yes, but we will have some guidelines to make it safe for them. You know, whatever they are requesting, maybe for a home care elder, for example, you know, they may be craving for some food, like chicken rice for the longest time, you know, but everybody is telling them, oh, you cannot eat chicken rice, you know, it's not good for you, it has too much fat, or maybe your wound needs to heal first and things like that. But over at St. Luke's ElderCare, our answer may be a yes to them, but we have to be creative. We have to maybe then decrease the portion of the chicken rice that they want. We can help them to get it. We can work with the family to seek consent, to educate the family on also for the quality of life of the elders, not just about medical and clinical. So a person is not just the medical and clinical portion. It's not just physical health. They have emotional needs. They have their well-being. They have their quality of life that we talk about. So autonomy to us is very important. Like sometimes in our nursing home, we let them shower at the time that they request. You know, we don't tell them that, okay, morning, 5 o'clock to 8 o'clock, everybody get up and shower. You know, if they want to participate in cooking lunch, preparing tea break, we will try to make it happen for them. Okay, giving them choices is definitely something that we believe in, and we wanted to make sure everybody has this opportunity. Again, as we age, it is so common for us to just take away their choice and, you know, just tell them what's best for them. But we can still tell them what is best for them, but give them a few choices of a similar type. Whether it be activities in the home, whether it be food choices, whether it be how they want to do things. Give them choices, give them the empowerment So that is my last philosophy of care at St. Luke's, to help them to help themselves and to help others, to make them be somebody who can contribute, not just receiver. So we do, provide them. Some of them are our activities leader in our daycare service. In the nursing home service, we empower them through environment setup. We encourage them to take their own shower. We have machines that can help them partially if they need help, but they don't need to be 100% assisted by another care partner. At home, if they love plants, can it be something therapeutic that you get them to take care of plants? Let's be green again, do planting again. These are things that actually empower them. They still can do something. So this is the care philosophy that all staff at St. Luke's ElderCare will have to embrace, and then work with our elders, looking at all this different aspect of the care. Okay. Thanks everyone for hearing me about our services. Before I hand over to my colleagues, our PT, our OT, our MSW, and our nurse to share on their experience in the home-based care services and as a professional, let's take a video, look at a video of our home-based care service. Thank you.
Yeah, I'm getting up as early as 5:20 in the morning. That's when I start all her preparation of her food, a daily medication in the morning, and an injection. I need to puree Mummy's food. So the pureeing her food consists of broccoli, fish or chicken. It's all for her motion. When she constipates, the next day she gets fever and she gets UTI immediately. So I'm that particular in her motion. She's taking her all this strong medication, and so it will calm her down, because otherwise she is very violent. She'll start hitting, she'll start pinching, she'll pinch Mommy, she'll kick, she'll even spit at us. So all this we need to tolerate. We need to have the patience. This type of dementia patients, it's not easy. It's not easy at all. At 2014, she started off with Parkinson's. Her Parkinson's were very vibrant. She'll be shaking, the whole bed will be shaking. She'll be non-stop calling. And then what she wants is for us to hold her. And then she'll say, did you see my jewelry? Did you see my cash? I don't know where I put it. So when we say, Mommy, it's here. Mommy, it's here. And I said, oh, okay. So we knew that these are the starting stage of dementia. She's afraid to wake up and walk. She needs somebody to hold her. I was still bringing her to polyclinic, but when I'm wheeling her, she's going down, 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 down. She cannot sit properly also. So I told Dr. Kwan, because she was with family physician, can I have someone to come home to view her instead of me bringing her here? We can't even wait at polyclinic. I said, okay. And she said, she referred me to AIC. From AIC, we got in touch with Dr. Lim, St. Luke's. That's when Dr. Lim came in and she started viewing Mommy every 3 months. Since my mother is very immobile, I decided to have the home care service to come in. Anything we find unusual in her or some different way of behavior, we will immediately call Dr. Lim and we will tell her, and she will channel us to wherever we need to go. And now it's so much better. She's so much toned down. Yeah, Dr. Lim was, I'm not exaggerating, but she's the one. And she's on the ball. Even though it's a public holiday, she will answer me. Yeah. much I'm very grateful. They are really a very good and nice bunch of staff in St. Luke's. Really hands up to them. Because we were not able to pull my mother up or lift her up. So I was talking to Dr. Lim about the hoist being to be railed up. Then that's when she told me, she said, no, now they have the mobile one. Then when I asked AIC, they said doctor should recommend. So when I went to Dr. Lim, she said of course she will recommend because you really need one. She recommended, and then AIC approved, and then occupational therapist from St. Luke's came in. He was also very helpful. St. Luke's, everyone is so helpful. So, they really know what the elders need. They're very good.
So good morning, everybody. My name is Naomi. I'm one of the nurses from St. Luke's ElderCare. I'm currently based in St. Luke's ElderCare residence with Lei Ling. So I hope you enjoyed the video that was just shown. In the video is my colleague, Dr. Lim Ping Ping. She is a very dedicated doctor. We have a team of them, so we are very fortunate. Maybe before I go on to my slides and share with you my nursing journey, let me just share with you a little bit on home care in the community sector, because I was fortunate enough to have a few years learning about home care, working in home care. Home care is an area, a sector where you have to be very innovative in how you provide nursing care to your elders out in the community, because as you have seen in the video, we are providing care in the homes of the elders. And in the homes of the elders, there are two things that are lacking. So one is you do not have very state of the art kind of equipment, unlike the restructured hospitals. And number two, you don't have the full clinical team behind you or with you when you provide the care. So it's very much how you innovate, how you creatively think when you provide the care to your elders. You do not have a steel metal trolley to put your dressing set on to push to your elder, unlike in the hospital. Maybe all you have is a bedside table. So how are you gonna do your dressing with just a bedside table? So there are a lot of things that will go into your mind when you provide care in the community. So let me just share with you then my journey as a nurse, and proudly as one. Okay, I hope you all can see the slide. So as mentioned before, my name is Naomi. I'm the care manager in St. Luke's ElderCare residence. Actually, I shouldn't have put the year down because then you all can guess my age. But anyway, here goes. So I graduated in Nanyang Poly in the early 2000s. Then I worked in NUH as a staff nurse, specializing in general surgery, cardiothoracics, and ophthalmology. After that, I decided to flee the nest to go to UK to sow my seeds as a nurse. It's only because I wanted to get more experience overseas, and you know, you are young, so you wanted to see what the world has to offer you. So when I was there, I continued my experience in cardiothoracics, and then moving on to high dependency general surgical unit. During that time, I honestly thought that my first love was surgery, until I did some part-time job in a nursing home. And that was when I realized that, hey, this kind of nursing is different. You actually like live as a family with them, on top of caring for them. So it's a very a different kind of relationship. It is not just a professional clinical relationship, but more of a family bond as well. So after I completed my contract in the NHS, then in the UK, I came out and I worked full-time in care homes, which is essentially our nursing homes in Singapore, but they call it care homes over there because everybody requires care, but not everyone requires nursing care. Yeah. So then I also did my bachelor's in the UK, and then I returned to Singapore a couple of years back. Oh, it's almost 6 years back already. I never even realized. Okay, so and I didn't want to go to the acute sector because for me, community care is always the thing for me after I realized what it's all about. So I had the privilege to work in ComHos, and then with St. Luke's ElderCare, I managed the home care team and the centers, our 22 centers at that time, and center-based nursing in the centers. So it was a very fulfilling learning experience for me because I could see how the flow is like in the community in Singapore, bearing in mind that I've only just returned. So I've also got to learn things from scratch. When I left, there was no such thing as AIC. No disrespect to AIC, I do love you, but there was none of you here at that time. Yes, so yeah, so currently I'm also doing my master's in advanced dementia management. I love elders with dementia. I feel that we can do a lot more for them. I feel that it's a niche here in Singapore, and there is a long way for us to go to improve care for elders with dementia in Singapore. So I have always preferred, I've always loved healthcare, and since young, I'm always the one rendering first aid to the others, to family, to friends. I find it very interesting. Yeah, and actually when I was young, I wanted to be a doctor, an obstetrician. But I was also a very playful child. Yes. I feel sorry for my mom sometimes, now that I'm an adult and I know what she was going through having a kid like me that time. So yes, so I'm not one for the classroom. I'm one for the playground. Yeah, so then obviously because of that, you can't get into A levels, lah, come on. And because of not being able to get into A levels, you won't be able to get into medical school. So I thought, oh, okay, nursing is also healthcare. I get to deal with all the gory stuff and all. So I chose that. And Nanyang Poly just opened their new campus in Yio Chu Kang. So we were one of the first, well, we were the second batch to go in and enjoy the facilities there. So also, because I wanted to prove an auntie of mine wrong, when this auntie of mine found out that I wanted to do nursing, every Chinese New Year, she will always be telling me, hey, why you want to go and clean people backside? People pass motion and you want to clean. This kind of job also you want. Yeah, so I wanted to prove to her that nursing is not all about that. There's so much more to nursing that probably the public don't know about. On top of that, community nursing. After having experienced it, community nursing is a whole new ball game on its own, which I will touch on down the road. Okay, so my NYP days, the best schooling days of my life, because I'm a bit more mature, maybe because my body physique is too big for the playground already, so I have more time to like study. And it was very interesting because learning is not just about doing your mental sums, learning your 听写默写, your spelling, you know, it was so much more. I love the clinical sessions in our clinical labs and all. I love hands-on. So it really opened my eyes to the healthcare world from a nurse's perspective. Okay, and I made the closest, tightest group of friends from Nanyang Poly. If you can see in the picture on the top left-hand corner from my side. Yeah, those are my group mates. Till now, we're still always meeting up and, you know, always telling our grouses to each other. Please excuse the picture and the bad hair day at the bottom. I was just experimenting with perming, but you know, you're young and you do silly things. So I have to say, as a student nurse, there was a point where I almost quit. Yes, I do love it. But what made me have the intention of quitting was during one of my clinical attachment, I didn't know how to use the sanitizer. Sanitizer is something that disinfects the urinal, the bedpan. Yeah, so I didn't know how to use that properly. Yeah. So when I actually put a bedpan with diarrhea in, I pressed a button and it started spraying out all the water that has come into contact with the diarrhea onto me. Yeah, so I thought, oh my goodness, this is just not me. Had come to learn about nursing to be sprayed with shit. Yeah, so yeah, as you can see in the other picture at the bottom, there's an animals behind with diarrhea splashing out. Yeah, that was literally what happened. But I got over that. So that's why I'm still here. Yeah, so my learning points from Nanyang Poly was that teamwork is very important. The team needs to be cohesive. Relationship needs to be there, needs to be present amongst everybody, because it's like, as a comm nurse, if there is no teamwork and you are on your own outside, if there is anything that you're not too sure about, and you know, teammates can't contact teammates, you know, then you're just on your own. You don't have a support system to actually help you. The support system don't have to be present when you're out there in the community, but it must be there at a phone call away. So you need to have those relationship, those ties that will help you out there or help each other. So also in Nanyang Poly, I realized the why it is needed to actually go through 10 years of primary and secondary school. Because I used to think that, wow, this is not needed, you know. Why do I need to learn mental sums? It's so that I can think fast enough when I'm calculating medication as a nurse. You know, there is the linkage there, but when you're a kid, you don't think about all these things. Yeah, so that was the pictures are showing me as a brand new nurse, newly graduated nurse in NUH. Yes, so the foundation years as a staff nurse, my goodness, it was horrible. I am not lying to any of you. Yes, this is a scholarship fair, but I have to be fair to you. It was horrible. It was horrible because my ward sister, if you can see right, the top picture right at the back in blue uniform, she was so strict. She was the strictest and the most scariest sister I've ever worked with. And it was a very steep learning curve because she expects us to learn everything. She expects everything to be done properly, you know. And I don't understand why you swap or you don't swap the urine bag. Doesn't make a difference, right? Maybe one will get a UTI, urine tract infection, may not. So why do we need to do that? So, but it's a period of time where I needed to grow up fast, and I needed to learn fast. And it was when I went over to the UK that I realized, oh, that was why she was so strict. Because then you get to see more things, and you actually can put into head why certain things were done, why certain things she got angry, why certain things she was so stern with. Yeah, so but I was fortunate enough that every the ward that I was in, we are very tightly knitted as a team. So we will help each other out. And because I'm the newbie, the seniors will always help me out and teach me things. So from my foundation years, I think that, you know, you cannot escape from teamwork. Even during your financial year, your foundation years, or during a student nurse experience, or as a com-horse nurse, as a home care nurse, as a center nurse, you cannot in healthcare ever go without teamwork. So every day is a learning experience, and your responsibility grows as you progress on in your career also. So then, of course, I move on to the UK. I loved my surgical high dependency unit days because it was so interesting, so many things to learn. But then, like I mentioned earlier, I fell in love with care homes. So the reason why my ward sister was so strict was because she has gone to the UK in her early years also to study. And I think then she could see, what needs to be, what's important in nursing. In nursing, management or preventive measures are important rather than treating. So if you can prevent things, you don't have to treat them, right? Yeah, so learning points from UK was, UK care home was a lot of learning points for me. Dignity. That time, dignity wasn't even taught to us. So I'm really glad that UK showed me what dignity is, and what learned helplessness is. We wouldn't think in our culture that we are actually cultivating learned helplessness. So learned helplessness is doing things for others that they are still capable of, but because you assume that they take on the sick role, they cannot manage it themselves. Okay, yeah. So person-directed care is all about how the person wants their care to be done for them. It's not what me as a nurse even or even a doctor want to deliver it for them. It's not how we want it, it's how they want it. And if what they want is actually not suitable, then as a clinician, as a healthcare professional, that's where I come in to curate the care in their best interest. Now, see, nursing nowadays and in the future is it's going to be very, very different from how it was 20 years ago. In the future, it's very much going to be about creative thinking. How can you creatively curate the care, come up with a management plan for your patients, be it in the hospital, be it in the community, be it in a residential-based nursing home. So yeah, very interesting, huh? Yes. So and also I learned a lot about dementia care. That is how I also developed my love for dementia. It is an acquired taste. Dementia care is not for everybody. And dementia care it requires a lot of patience, a lot of creative thinking, a lot of forming the bond with the elders or with your patients and their family, getting to know them on a very personable basis. So then I came home. Coming home, like I said, I worked in ComHos. So that was a dementia ward in a ComHos. I thoroughly enjoyed my time there. So there were, I was able to see how, from a ComHos, how it goes on to community care, to home care. When is home care required? When can the patient actually be suitable for center-based care? When is center-based nursing coming into place? Is it when they have an injury, a dressing, a wound that needs dressing? If it needs dressing, can they have it at home, or would it be better in the center? Now all these, you can see the continuity, the whole flow from in community care itself. Community care itself, like my colleague Levin presented earlier, it consists of home-based care, center-based care, and even residential-based care, where I am now at. Okay, so that mindsets have to change, because we are moving forward with the type of care that we provide. But of course, there is still some way more to go for us as a healthcare sector. Yeah. So so my learning points from being back home, I learned that because I was very eager to put changes into place. But I have to learn to take a step back, because mindsets here are not the same as back in the UK. I mean, and certain things that happen and are really good for the UK may not be good for here. And so I need to learn how to marry them together before I implement the changes. And changes can only be implemented if there is a buy-in from all stakeholders. So this part is a learning curve for me, even until today. Yeah. So my personal thoughts throughout my journey. Now, as a nurse, as a student nurse, it's just all about passing exams, okay? Passing your clinical attachments and all. Foundation years as a staff nurse, please let me finish my shift so that I can go clubbing tonight, or please let me finish my shift so that it's my day off tomorrow and I'm totally shagged. Yeah, so UK years, it's all thanks to my ward sister then, she equipped me, not just for Singapore, but for overseas as well, which I didn't realize at that time. Yeah. So yes, there is more of a work-life balance there, but there are also things that Singapore may be a bit better, UK may not, then the other way around. So like I mentioned earlier, what's good there or what's good here may not be in the other country, but we can always learn. We can always learn, then we can always curate it for the local template of patients. So now managing a team, oh gosh, where do I start? We set up this nursing home in May last year, bang right in the middle of CB. It was so difficult because we couldn't get anything anywhere. All the deliveries stopped, and we were the only nursing home that opened during that time. So yeah, but we learned as we got on. We learned, we changed things, we brainstormed together and all that. So now the mentality is how do we bring everybody forward together. Okay. So some reflective thinking, these are all what I've mentioned earlier, and I think that to move forward in the future, it's always about providing that person-directed care, person-centered care, and of course consumer-centered care, because nowadays in this generation everything is about consumer. Okay, so these are all our core values, and my personal values is GRIT, the acronym of GRIT, which is about growth, responsibility, integrity, and transparency. Okay. So these are some attributes that I would think that each student nurse or each nurse need to have in order to move forward in the nursing world, and that's being humble, being creative, being courageous enough to fail, and have a realistic vision. So this is just to show you what we have done in our nursing home for Christmas last year. So we decorated the whole home using recycled materials together with our elders. So they all had a part to play in all this, and it was so fun, very tiring, but very fun. And that is why I say creative thinking. Okay, so these are just some of what's been happening in our care home. Of course, if you want to find out more, this will take quite some time for me to tell you all the stories, but you're welcome to visit us here when it's more convenient. Yeah, so so these are, okay, so in nursing, right, I always think that it's very important to have a support framework. So your support framework can be family, friends, it can be your pet dog, can be anything. But support framework must always be there. You must know how to de-stress. That's very important. Whether you're in community nursing, residential-based nursing, acute nursing, whichever. Because if you cannot maintain a healthy state of mind as a clinician, you are not able to give that top-notch care to your patients or your elders. So this is something that I came up myself. I feel that nursing is a unique profession that blends the art of love and compassion with the medical intelligence to provide good quality patient care through a genuine and selfless heart. Because especially much so in dementia care, the elders can tell whether you're genuine or not. And if you are not, they will know also. Surprising, huh? Okay, so my last slide is just wanting to tell you that you will fail many times as a student nurse, whichever sector you want to go. Of course, community sector is the best. Yeah, but you must be ready to fail before you achieve success. With that, thank you very much. I shall now pass you over to my rehab colleagues.
Hello. Hello, everybody. I'm Felicia. Thank you, Leiling, just now, and Naomi for your sharing. And thank you also, AIC and MOHH, for giving us this opportunity to share. Yeah, so let me just share screen. Okay. Yeah, oops. Oh gosh. Are you all seeing? Ooh. Am I sharing directly from the? Ooh.
It's okay, I can share screen.
Okay, then you share.
You stop sharing.
Yeah.
Okay.
Okay, yeah. So I'm Felicia. I'm the OT.
Yeah, I'm Christine. I'm the physiotherapist. Yeah.
So I've been an OT for about 15 years now, and yeah, loving my job every day. I'm glad that I can share what OT is about today in home therapy. Yeah, home therapy is really fun. Yeah, Christine.
Yeah, so I'm a physiotherapist and I'm working at St. Luke's ElderCare doing home therapy as well as center-based therapy. I've been working for about 6 to 7 years and worked in hospitals, community hospitals, and other community-based services as well. Yeah. So shall we go on with our slides?
Yes, please.
All right. So home therapy, today we're going to talk about home therapy, and the main things that we'll highlight will be firstly be the goals of home therapy, then followed by the home therapy rehabilitation flowchart, as well as some challenges of home therapy which we face daily, but we also take it in our stride. Yeah. Okay, so the main goals of home therapy when we first step in would be to ensure the safety of elders at home, and to as well as to engage them in rehab or activity, because some elders are just at home and very sedentary, not doing much. Caregivers may not know the best way to engage them as well, so that's where we step in. And with safety of elders, it's with regards to the home environments, because sometimes it's not safe for the elders when they have their mobility compromised. Yeah. And secondly, the second most important goal for home therapy would be to ensure that caregivers caring for elders are competent and safe with their care. Yeah, because these are the two main people that we look out for when we do home therapy. Yeah. Okay.
So yeah, actually just like what Naomi shared just now, home therapy, home care and home therapy is very unique because we have to be very independent, very creative, very resourceful. And so for us, the most important thing is really the environmental setup. So what we do here, so what we do here is that we look at the environment that the elderly is living in. Okay, and then we see whether is it safe, and then if it's not, right, we see whether, as in, we will try to see whether the elder can do a smooth transition from one part of the house to another, like from their hall to their room, or from the room to the kitchen, right? So if it's not, we will link the elder up with like ease program with HDB, help them get grab bars, get their floors treated so it's non-slip, and then help them to get ramps. And if let's say they have too much clutter in their house, maybe we can work closely with a medical social worker. Yeah, so Jody will be presenting later. Yeah, to maybe help them to get people in to help them clear up the clutter. And then maybe we can see if their lighting is not enough. So usually when we do home therapy, sometimes we would need to see whether there is enough lighting. So we would see whether maybe we use an app like a light meter to see whether there's enough lux. So usually we would expect something between 100 lux to 300 lux. If let's say it's anything less than 100 lux, maybe the elder might have a little bit of difficulty seeing in that lighting. Yeah, so we will also, maybe we can also work with the medical social worker to help them to change the lighting. Yeah, so that we can provide more light for them. And actually, in some cases, the elder doesn't even have enough money to change the lights, or they may even have this thinking that they want to save electricity and maybe not even turn on the lights at all. So yeah, so that's where we introduce maybe LED lights, which would take up less electricity. So we tell them, don't have to worry. Plus, there's a lot of usage that they can use, so they don't have to sing so much lah. Yeah, and then also if let's say their house, the flooring has got too much friction sometimes, like maybe the shoes that they use is not ideal for the home setting, it may also cause them to fall. So these are the kind of things that we look into lah. Yeah.
So just some pictures on what Felicia mentioned earlier.
So like the uncle is holding on to that grab bar. Now that is the standard grab bar that they give. I think every few years the government does review what kind of grab bars they should. I mean, if the grab bars are safe and if they should upgrade the grab bars to something else, because previously they were all stainless steel grab bars, and then they didn't have a lot of grooves on the grab bar. So sometimes the elder, even when they're holding onto the grab bar, their hands might still slip. So this is what you see in this picture is an upgrade of the grab bars that they have, that they're providing in the community. Yeah. So other than helping them to get the grab bars, non-slip flooring, and the ramps, we also help them to see whether there's too much clutter in the toilet, whether the setup is ideal, because sometimes they tend to put things in places whereby they're supposed to they block their own path.
Walkway,
So
yeah.
the walkway, yeah. So it can be very dangerous, and because they're so used to it already, they don't actually see it as a problem. They just try to get around it. But yeah, so we would go in like as a professional, try to get them to change it, because sometimes, honestly speaking, even if their children tell them to change it, they may not change it. So so their children sometimes will buck up with us. They tell us, hey, I have to tell my mother to get rid of this thing because it's false risk. So it's not, sometimes it's not that their family members do not know that the setup is not safe. They know, but they can't do anything about it, because the elder would say something like, it has been there for the last 30 to 50 years. Why do you need to change it now? Yeah, so that's why we lend our voice as well to go in and make a few needed changes.
Yeah. So another thing that OTs deal with quite a bit would be BADLs and assisted. You want to explain what BADLs are?
Yeah, Christine is too kind. Honestly speaking, right? In home therapy, we rarely use the term PT or OT, or we use it less because we see ourselves as home therapists. Because in home care, home therapy, it's more transdisciplinary. Because like Naomi mentioned earlier, we are usually there on our own. So if let's say I go in there and then they say, yeah, I don't know, this walking in, I don't know how to use. I cannot say, wait for the PT to come in. She will teach you next week. Within this week and next week, the patient may have sustained a fall because they do not know how to use the walking aid. So we have to, if we may have to check with the PT, and then we will advise them accordingly. But if we know, we can also share with them. Yeah. So this part about the assistive, the feeding. Okay, so we usually as OTs we do a lot of ADL training, and then we prescribe a lot of assistive devices. So one of them would be the feeding. So in this slide you can see, it's okay. In this slide you can see that there are angled utensils, there are built up utensils, because sometimes the patients might not just, the elders might just not be able to grip the spoon or the fork amply. So, it would just prevent them from being able to use the spoon and the fork. And, they tend to therefore think that, oh, now I have to rely on the maid because I cannot hold on to the fork and the spoon. But that may not be the case. If you prescribe them with a built-up handle, even though they have decreased grip, they will still be able to use the fork and spoon and feed themselves independently. So some people will ask, oh, but like how, I've only got the use of one hand, but that's fine because, with things like you see in the second picture, that's called plate guard. With things like this, when you prescribe them this, when they try to scoop the food up from their plates, they can just push it against the plate guard and the food will fall into the spoon, or they will not run off the plate, and therefore enabling them to use the plate even though they only have one hand use, right? And some of them, if they even have suctions at the bottom, like you see in the third picture, and that enables the bowl to stay in place and not keep moving around while they're eating their meal, right? So there's also one-handed boards for clients with elders who suffer from stroke. Yeah. So there are many assistive technologies available in the community. So the home therapist really just has play the role of connecting them to all these things, because normally day to day they wouldn't know what are available unless we bridge the gap. Yeah. So even for Parkinson's patients, there's even like a special technology whereby there's a smart spoon that's able to read the amount of shakes you have in your hand, and then the tremors, and then counter it. So yeah, things like this. So the next thing that we are concerned about is whether the elders are able to dress themselves at home, because this is something that is, we do normally every day, right? On our own. We don't need other people to dress for us. So if, let's say, as much as possible, we try to help the elder to be as independent as possible at home, even with their dressing. So we prescribe things like the shoe horn. This one, most people will be used to seeing it in the community, because sometimes they even sell it for like 50 cents. I think IKEA sells it too. Yeah. So, but simple things like this, like just a simple piece of plastic can help the elder to put on their shoes more independently. Why not, right? And then there's a dressing stick as well, long-handled reaches, and that would allow maybe a total hip replacement client to be able to still dress on her own without having to rely on a maid. And honestly speaking, although these tools are slated for dressing, but we don't always have to use them for dressing. They can use it to take things off the shelf, pick things off the floor and stuff like that as well. So we teach them at home how to use this kind of equipment amply. Yeah. Okay. So yeah, so another area that we find that a lot of family members in home care and home therapy, they're not doing it as often as they should. I cannot say they should, but ideally they should do it more often, but because of certain restrictions or certain limitations, they can't. So that's showering. Yeah. So we try to help them by prescribing them with things like you saw just now in the video, prescribing them with like a hoist, so that they will be able to lift the elder up and put them into the commode and get them into the toilet. Like you see in this picture, there's a ramp. So sometimes the family members are very resourceful. They are able to get ramps themselves. But if, let's say, they do not know what resources are available, we would therefore direct them to, like just I mentioned, the HDB Ease program. Then the Ease program would come in and help them to put up ramps, over the curb in the toilet, and then of course outside also, so that they can also access the community, which we'll be talking about a little later. So so showering, it's something that actually a lot of elders enjoy, but they don't get enough. So, and a lot of times the elders, the caregivers of the elder, they're also very afraid of using all this equipment. So as home therapists, we go in and we teach them how to use the hoist, number one, and number two, maybe the commode. Like in this case, they're using a tilt in space commode. So, you know, sometimes all these names and this technology, however simple they are, they can be very daunting for the elder. And they do not know who to go to also, who to approach to teach them this kind of things. And yeah, it's a bit difficult to invite somebody to your house, and you know, even no matter how experienced they are with using the equipment, if you know, it's how should I say, it's not
also
something.
trial and error, I would say, because different houses have different setups and
Yeah.
with different caregivers, different set of skills as well. So whenever we go in, we have to also do trial and error on our own. It's not cookie cutter for every single elder and caregiver. Yeah.
Yeah. So yeah, they would have to we would have to 随机应变. Oh my goodness, how to say that in English?
Adapt.
Oh yeah.
Yeah.
Yes. We must adapt to the situation. Yes.
Yeah. Okay. So the next slide. Sorry. Okay. So activity engagement at home. So these are some activities that we have done with some of our elders. On the far right, you can see one of our home therapists, is trying to get one of our elders to go back to playing a bit of golf, his favorite pastime. Yeah, and he's doing quite well with some assistance. And then there's also a bit of hydrotherapy at the bottom, the center of the slide. And on the left side, a bit of gardening, just simple watering of plants, and card games on the iPad. Yeah. So these are things that we do to engage them, like things that they used to enjoy doing and were not able to do after getting a bit older and having a bit of limitations. So we also go in to help them, get a better quality of life and be happier in the sense that they're able to do things that they used to be able to do with a bit of modification. Yeah. Okay. So one of the key things as a home therapist, we have to make sure that they're very safe at home, as mentioned earlier. So having frequent falls at home is something that is not safe, because then you're going to get injuries and so forth. So one thing that we do is a lot of gait training within the house, as well as a walking aid prescription. So on the left side of the screen, you can see the elder is using a walking frame. And on the center top part of the screen, you can see that he's using a quad stick. So these are things that we have to figure out what's best for elder while he's at home. Because sometimes when you're in hospital, they present very differently and they go home with a different set of walking aids compared to what they should be using at home. And because when they're at home, they have a different way of doing things and they're more comfortable. So we see how they're like at home, and we correspondingly assess and then prescribe the appropriate walking aid, and as well to train them to make sure that they're safe while using them. Yep. Okay. One other thing that a lot of the elders enjoy doing is obviously being out of the house, because most of the times they are cooped up at home and they just look at their caregiver or just look at the TV or newspapers. So we try and incorporate that quite a bit with our sessions. We do quite a bit of strengthening and functional exercises in their nearby exercise corner, and we modify it to what they can do, obviously. So they also get a sense of like accomplishment and get motivated when they see that they can do this and they see other elders in the exercise corner exercising. So it's quite good for them, and it also strengthens them in a way, and it's also quite functional. Certain things like standing up using the support of the bar. Yeah, so that's something that we try and work on as well.
Yeah, because like what Naomi said just now, so you know, it's difficult for us to be able to bring a whole lot of things with us on home therapy and home care. So we cannot be lugging like some exercise equipment with us to every single patient, because every patient is different. I mean, every elder is different also. So we cannot use one equipment for every single elder. So having all this exercise equipment in their community, you know, actually also it's a good option for us to use. And yeah, and a lot of times, like what Christy said just now about the activities, you know, the elders don't actually think that they can go back to being able to do all these things again. So a lot of times during home therapy, we're also trying to empower our elder by showing them that they actually can return to all these things that they used to be able to do.
Yeah. And also one more thing to add on is they can continue doing this with their caregivers if they're safe. So let's say they can go down and do this simple exercise that we've done with them. Therapist has assessed and said that they're quite good. The caregiver is good with handling them and they can continue on their own. So that's a step out of their house to getting towards further rehab in other services.
Yeah, and usually when the elders realize that they actually can do all these things again, a lot of them are very, very moved. I think, Christine, I don't know about yourself. I'm sure you have already experienced a few elders who have broken down in tears because they're so thankful that that we showed them that they can actually do all these things when they thought they couldn't anymore.
Yeah, and one of the other more important parts is being able to go and ambulate in the community like they used to before. So a lot of times elders, their caregivers or family members don't have the time, or they're not confident to bring the elder out for walks. So this elder was sharing with me that she has been quite cooped up at home because she's also caring for her bed-bound dementia elderly husband together with her daughter. So her daughter is quite stressed out as well. So she was asking if she can go out for a walk. She would like to look at her neighborhood. She hasn't been around for a while. She was quite happy to look at fruits and flowers. So very simple things that will make them smile and make it easier for them and their caregivers. That's also what we take into consideration when we figure out what to do on that day itself. Yeah.
Yeah. Yeah. Sometimes they even they even forgot how to use lift. When previously they're able to use the lift. I mean, press lift buttons with their right hand. Now they rely all on their non-stroke hand. So this lady has stroke. Yeah. So she just relies completely on her non-stroke hand. But on this day she realized that actually she can use her right hand again with some support from her left hand. Yeah, and we also try to make it very fun. So it's not just for going into the community. Sometimes we even get them to, like, for example, after the COVID-19, after the circuit breaker, this guy was just like the guy in the center picture. He was just like dying to go out of the house. So we got him to scan the various QR codes, and we told him, okay, you have to get up to 5 QR codes. And he was so motivated. He was like, I'm gonna get all 5 QR codes. And he was having so much fun in the community. And after that, after this session, he felt confident again to be able to go out on his own, actually.
Yeah.
Yeah. So, and sometimes it's not just about working with the elder, it's also about working with the caregivers. In this case, we empower the caregiver to be able to push this elder around in her wheelchair, because her wheelchair was also not the easiest wheelchair to use, because there are multiple functions. Yeah, so the caregiver was actually quite worried also that she may not be able to handle it. But we did, we brought her everywhere. We took her over ramps. We helped her. We showed her how she can stop, using the brakes behind at the zebra crossing, how she can push the wheelchair up a bus, how she can secure it on the bus. So yeah, after this session, they actually went all the way to Changi to see Jewel for the first time. So that's stories like this are very heartwarming for us as home therapists.
Yeah. Okay. So cognitive engagement, you guys do that quite a bit as well during sessions, right?
Yeah, so a lot of times, when the elder is starting to get forgetful, the family members would just, they're trying to be helpful. They're trying to, they just love the elder to the extent that they will just jump in and do everything for the elder. So what happens is that usually when that happens, the elder will start to decline or deteriorate further cognitively. So in this case, when we see these things happening at home, in the elder's environment, we will start to tell them, instead of giving answers, you can actually prompt the elder verbally, visually. We show them how, or physically. Yeah, that's the easiest. And then show them how the elder can increase engagement in activities at home. Like, for example, the gardening that we showed you just now. And then of course bring them out into the community. Yeah, and usually these caregivers, they're usually quite overwhelmed, so they just do things also out of habit. So they just help the elder out of habit. But you know, when we empower them, when we show them that we're giving them support, also that sometimes they also have to take care of themselves. They are a little bit more encouraged, and they will do better at home also lah with the elder. Yeah.
Okay. So another quite important aspect that we tend to not really classify under therapy or rehab would be providing support to elders as well as their caregivers. So support in the form of tech support. So basically nowadays, appointment reminders are sent to elders via SMS, quite a few of them. And I will have some elders come up to me and say, can you help me? I don't understand what this is. Do I have to go for my appointment today or tomorrow or next week? So we have to help them understand what all these things are and try and get them to learn new things, like how to set an appointment in their calendar, or to how to use the message functions. Yeah, so that's a certain aspect of non-rehab related stuff that we do as well. And especially for elders who live alone or do not have caregivers who are always available. So sometimes they work long hours, and they only come home really late. So some simple things we can help out when we can would be like help him throw the rubbish, because his rubbish chute is all the way out one long corridor down, or to just boil water. Yeah, simple things. Yeah. So another aspect that, like as I mentioned in the first few slides, that are important would be the caregivers that are caring for the elders. So we will have input in the caregiver training to see whether they need any more training, helping out with the elders, or how to communicate with elders and certain things like that. Because we have to understand that caregivers are as important as the elders themselves, because caregivers have to be okay, and I mean they have to be able to care for them, the elders, for elders to be able to have good quality of life. Yeah, so we have to provide good support to the caregivers as well. So simple things like if they have back pain, sometimes from helping transfer elders, we teach them simple back exercises or stretches and give them tips to protect their back, because we need them to be healthy to be able to care for the elders. Yeah.
Yeah, because sometimes quite a few times we've seen the helpers get very stressed out. They kind of feel like, oh, everybody is just concerned about this elder, then nobody cares about whether my back hurts, or whether I need a little bit more rest. Everybody's just elder. So we go in, we also tell them, they're also important. So when they get emotionally a little bit more balanced as well, they are in a better frame of mind also to care for the elder, and ultimately the elder also gets to benefit from this.
Yeah. So as I mentioned earlier, the flow chart for home therapy will start at home, obviously, and it's mostly when the elder is unable to leave the home to attend rehab elsewhere. So let's say they're not strong enough to tolerate 1 hour session in a center outside. So we start at home first. And if they're not safe at home, we can't bring them out into the community for rehab. So things like that, we have to settle and make sure they're good at home first, because that's most important, where they spend most of their time. Then when they are good at home, we can refer them onwards to, if they get better, they can go on to a center-based day rehab center, where they do their rehab in a center with other elders around. And so it's a lot more of a social aspect as well, because they can interact with elders, caregivers, and the therapists, or just the staff at the center. Yeah. And then they can also continue on towards just doing some home exercises with the caregiver, once caregiver and elder are like happy and safe doing these exercises at home. And if they're good with that, then we can continue towards that direction. And there's also an option of moving forward with a home personal care. So home personal care will come in and provide assistance with caring for the elder. Let's say when the caregiver is unable to do it by herself, showering, then additional person will come in, home personal care will come in and assist with that. Daily activities, or even just to engage the elder in singing of songs. Some of them do that, watching news, reading news. So just have an extra person in to provide support that the caregiver and elder will need to continue on doing his daily routines. Yeah. Okay, so some of the challenges that come with home therapy. So there's obviously going to be challenges, but that's what makes it exciting, I would say. Because I mean, no challenges, then it's just very boring. Yeah. So the main thing is it's very unpredictable, because some days you won't know how the elder will present. They may be really good the 1 week, and then next week they're having a bad day or just not feeling well, so they're not up to it. So sometimes what you have planned for them to do on that day may not go through. So you will always have to think on the spot and be adaptable, like we mentioned earlier. And like the fourth point, you have to be adaptable to the situation that you're faced with. So with how the elder presents, and as well as your environment around you. So you may not have a fixed environment all the time, and you won't know what different households are like. So you have to be prepared to also be resourceful and creative with what you have at that point in time. Because like what Felicia and Naomi mentioned, we can't be lugging around everything with us. And most importantly, we also have to be very confident in our own independent decision making, because we'll be there by alone most of the time when we're at the elder's house. But we obviously have support back in the centers and stuff like that. But once we're there, we have to be able to make quick and correct decisions if required. Yeah. So sometimes that's a bit challenging, because it may be quite daunting at times. But so you just have to figure it out and just be confident in your decision. Yeah.
Yeah, I think one of the most unpredictable thing was, I think just now Christine also mentioned about sometimes when we go into the elders' home, we also get to do things that are not really very therapy based. Yeah, some things that they need lah. But I think one of the most unpredictable situation that one of my fellow home therapist friend has shared with me, thankfully it hasn't happened to me yet, was that they turned up for home therapy, and all they faced was a very bad smell. So I think that yeah, this is a 1 room 1 hall flat. So I think y'all can guess what happened to this elder. And so the next 1-2 hours was just filled with calling the police, masking up, gowning up, and then doing the needful lah. Yeah. So yeah, it can get really unpredictable.
Yeah. So if you really love challenges, yeah, this may be for you.
Yes.
So I think to close, we'll just share how does home therapy bring us joy. Just 3 main points. There's actually a lot of points, but we have to summarize it. If not, we'll be here for the whole day. So basically, it's very rewarding to conduct rehab when the elders actually living in their actual living environment. So we get to see how they actually are like at home in their own little comfort area, and how their personality actually shines through as well when they're at home. So we also can tailor it better to how they would be like further down the road when they're just living at home. So not very the rehab doesn't have to be like very rigid in a way. It has to like accommodate how the elder and his or her living situation would be like. Yeah. And the second one is we enjoy building relationships with elders and their family or caregiver, and engaging them in the different activities that they enjoy. So that's quite fun, and it's always quite nice to build relationships with people and just learn more about different elders and what they have. A lot of wisdom to share at times. So it's good to learn from them while they learn from us as well. Yeah. And the last one is most importantly, it's a place where you can be very creative in a way, because you have to be creative as well sometimes. And so that makes it very fun lah, like, because things are not just like the same thing every day. You have a bit of different challenges to face and deal with every day, and then you just be creative, resourceful, and then it makes it fun. Yeah.
You have to be really resourceful here, then, because we need to also know like what kind of programs we can like direct them to. Maybe if they need to go back to driving, we can direct them to TDSH, driving rehab, and then yeah, for all sorts of equipment, yeah, AIC, ESMF, yeah.
Yeah. Okay, so I think that's the end of our part. So moving on, I think Jody, our social worker, will be sharing.
Okay, hi everybody. Sorry for the overrun. I'm just going to take a, hopefully you are still there. Yeah, I'm going to just share with you about my journey as a social worker for the last 20 years. But I'm just going to try to find my slides at the moment. Just give me a minute. Okay. Oops. What happened to my slides? Okay. Sorry, just. Oops. Okay, got it. Oops. Okay, hi everybody. My name is Jody. I'm a social worker from St. Luke ElderCare. So today I'm just going to bring you through my journey as a social worker for the last 20 years in my journey. So I went into indirect work, doing like managing program, elder care policy, with then the SG enabled. So what happened is after coming out from indirect work, I went into direct practice, something that is closest to my heart. So I went on to do like organ failure program, providing psychosocial support, elder care befriending. This was my first job and I stayed there for 5 years. And I think it was very meaningful as a befrienders, helping people, elder, getting befrienders on board, increasing their social system support. So I thought that was so meaningful to my work. And I got a little bit burnout. And from the elder care, I went on to child protection. So it's really the extreme life stages. So from elder to all the way to back to child protection. And when I felt that child protection didn't resonate well with me personally, so I went back to elder care again. So I went on to do like case management work and like championing of advanced care planning. I'll share a little bit more about ACP. So basically in my last 20 years, I was a majority, as you can see, of my life is about good 90% is in direct work. So this is something that, like I say, is really close to my heart. So why social work? This one got to sound a little bit of goyok lah. Why social work and not other profession? So as a social work, there's so many opportunity to work in variety of setting. All right. And I guess the core vision, the core value of social work is about being able to help people. So it is really like a privileged opportunity to assist people in all other professional manner. And also, when you come to the elder life, not just elder, but probably elder client, you help to empower and you enable life. So this is something that is of interest to me because again, it's my own personal values and my goal that resonated in my life lah. So social work, as a medical social worker, I think there's a lot of collaborations. So you get to work with multidisciplinary team. So you hear people like Felicia mentioned, wow, got to do decluttering work, but it's more than just decluttering work, I must say. So there are so many things that involve as a social worker. So again, social worker is not silo, you work as a team. So many of the time in the system itself, you have to get your clinical inputs from your therapists, your nurses, your doctors, and even at center-based services, we have to get input from our colleagues at the center, how client coping, so it is, that's the beauty of social worker. There's so many systems that you interact in. So again, why social work career path is so versatile, many job opportunity. So again, if let's say, in the crisis, social worker profession will never die down because there is always so much of demand. Yeah, so basically you can work in an elder care or even in a child area or the physically disability sector, so they are just so versatile. Okay, so I'm going to move on. Why then community care? So the picture that you see over here, this is real photo that I've taken. Okay, why then community care? One of my earlier days in restructured hospital, I was burnt out. For the really short span. And I find that for me as a worker in the hospital, I feel that my role was just to facilitate nursing home application, getting patient out from back to the community, and basically just to ease the bed crunch in the hospital. And I felt that the work wasn't so meaningful at that point in time. So I thought I wanted to go back to community care. So I think one of the goal was for me then was to really prevent premature institutionalization. To me then, what is aging in place for elder? So is it about sending them to the nursing home? Is that my role in the RHs, in the restructured hospital? So I felt that there's more to be done like in the community. So I feel that as a worker, it is important to be trained to link the elder back in the community and the home-based services. So there are a whole suite of services in the community, and I must say well done to AIC. Their organization has developed so many interesting program and sustainable program to help elderly to age in place. So I guess as a social worker, part of our role, it is also to reduce fragmented and health social service system in the community. So back in those years whereby healthcare, social care doesn't really interact. So social system is a unique system by itself, and healthcare is also a system by itself. So I find that something that is lacking, or rather a service gap on ground, is about integration. So this is something that there's a lot of advocacy work by our SASW, our Singapore Association for Social Worker president, to talk about integration. So I guess much has been done over the last few years about integration work between health and social system. So I guess our role here is very much to serve as a bridge in the community, just to ensure that the elder care and the discipline of many systems marry each other. All right, and next, focus on elder and caregiver needs to ensure optimal care. I guess for us, it is very difficult, especially from the community, whereby there's so much of lacking of infrastructure, especially for elder care. That's when elder care, when elder get discharged into the community, at times, especially when they're living alone, because in St. Luke I do community case management work. So many of the time when elder are being discharged from hospital, services are not well transited also. So there are times whereby you have elder who get discharged home when, they don't get their meals, or they live in a very cluttered environment. So I think the role of the social worker from the community, we have to ensure that there must be seamless transition. If you see from the picture on this screen, you see cats. These are real photos. This is a classic case of my community case management client. She's an elder who is 65. She's a hoarder, really hoarder. It's a three-room flat, and she basically have not cleaned out the house for the last 20 years. And you see here there are actually 2 cats. In fact, previously she actually kept 10 cats. So she has such a low vision due to cataract. She couldn't see very well. So in fact, 2 of the cats actually passed away at home. And she doesn't know. So imagine the smell. And this house was actually filled with cockroaches. It was really tons and tons of cockroaches. And we got in a pest buster to come on board to help to do fumigations and to remove the town council, to remove all the clutters. So I thought that the personal takeaway for this classic case, it was not just providing emotional support for my client, but it is also for their pet. So I work with some agency on animal removal, because I think because of the poor health of my elder, these 2 cats are also living in a very hazardous condition. So I guess this really create deep meaning of my work here in the community care. Yeah. So moving on to my day-to-day, I think largely I've shared a little bit more earlier. We do conduct psychosocial assessment to determine the elder mental, emotional, and social needs. So these are quite basic knowledge that we need to have. We talk about care coordination, resource navigation, financial assistance, counseling and therapy, crisis management, Okay, crisis management, this is very real. Social worker, we do a lot of crisis management. So just like taking an example, yesterday, very early in the morning, I received a text from my elder family. So it was a case of my center-based client. She's actually an enhanced dementia daycare client with us. So the family was really at burnout. There was so much of significant burnout faced by the husband as a caregiver. Himself is also receiving dialysis, and having to deal with a behavioral problem exhibited by the wife. It was just so crazy for him to handle. So he told the daughter, say, I am just going to bring your mom down with me. I'm going to jump down with her and I'll end my suffering. Hearing that, at that moment at 7:05 a.m., I received a text. I jumped off from the bed. This is real. Of course, I felt the obligation to really reach out to this daughter early in the morning. Despite actually I was still sleeping at the hour. But I find that if I don't address it then and there, I worried something might just happen. So I called the daughter and feel that, hey, how's dad doing, that kind of stuff. So, largely it's just to find out what's the situation, and we have to calm the family down. Thankfully, the client get to our center, and we just had to ensure that, we communicate with my center colleague and also with the healthcare system in the restructured hospital, how to bring in services for these client, so to ensure that it is not fragmented. So when if the elder returns home, we know that what are the services in place. So these are some of the things that we then and then you have just to respond. So even at late last night, 11 p.m., I was just doing social report just to apply for financial assistance for this client to come to our daycare on a weekend, so that elder get relief on a Saturday. Even a Saturday, even one more day can be quite significant to the family. That one day can give a bit of relief, we will do so. So yeah, so that's the beauty of crisis management, and I enjoy doing it at this moment, still at this age. So, okay, facilitating advanced care planning conversation. This is something that is so exciting for me in this organization. Advanced care planning, ACP, in short, it is not new. So even at ACP National Office, this is something that we want to champion. So as a lead, we are starting to talk about conversation in regards to end-of-life care, in advance, what is our healthcare preferences, the kind of stuff. So we want to produce like a safe platform for our elder and their family to talk about conversation that will make meaning to their client's life at the end of their last journey with their families. So these are the meaningful work that we engage on a day-to-day basis. Sounds quite a lot, but it's not that really a lot every day. Of course, that could sum up my weekly kind of tasks, yeah. So I must share with you, these are really real challenges to me. Even at this point, in the community care, it is really overwhelming caseload. It is nothing short of like if you're in a restructured care hospital, it's equally as bad. But in community care, it is even worse, because you have to be reachable sometimes, especially when you're managing crisis case. Yeah, so this is really overwhelming caseloads at times. Again, it is also quite unpredictable schedule. Sometimes I receive texts. I think it's something that I'm learning. I need to have a good, clear boundary of my own personal work life and also my professional work life. Sometimes there and there, I'll just check on the line and just to see whether how is this client coping with the care of their loved one with dementia, whether or not is there some aggression at home and what, So that's why I guess a lot of the time, even during sometimes public holiday, I'm also at work. Okay, so anyway, not to scare you off, I'm sure there's also reward at the end of the day, like how my team actually shared earlier. So real paperwork is overload. You seeing a client, it's not just you see him and that's it, and then you close shop, there's so much of follow-up to be done. You have to put out like referral in the system, you do out a social report to support your case management, and stress and emotional burnout, it is very real. In fact, my life, when I started befriending program, I was burned out in my 4th year of service, and I felt that, oh my, this is really I remember this very clearly. I went to a wake. I attended my elder wake. I went there, but there wasn't any emotion that I could relate as when I first started off my profession. And I thought, something is missing. What happened to this emotion that the kind of enthusiasm, the kind of aspiration, what happened to that? It was gone. And I couldn't even shed a tear for this elder who was so close to me. And I know that I have to step back. And actually I left the organization for a breather lah. So I guess this is something that is very real. I saw some question about how then do we manage burnout. I guess what is helpful in St. Luke, I get supervision still. I get to meet up with my supervisor. We will talk about, we will process about our own professional struggle, challenges, So that gives you a safe platform whereby you learn about your own growth professionally and also personally as well. So then come to the last few slides. Okay, so the reward of being a MSW in community care, in fact, this is really what I enjoyed doing. Serving as an advocate for my elder. End of life work, I must say, is really close to my heart. I've done organ failure program before, and I've journeyed with elder in the last lap of their life and with a caregiver. And I find that this is really such a privileged journey. You can't just invite yourself to enter a house, when people are just grieving, But I guess you as a social worker, you go in and you find out a bit about their environment. How are they, especially we talk about anticipatory loss, how are family coping, recently I just done an advanced care planning discussion with my clinician, my doctors, and it was such a touching moment. We actually engaged the client, the elder, to step up to talk about his his end of life care preference. It was really such a emotional moment. There was so much of affirmation given by the family to the elder. In fact, the elderly mother was also there. She was in her 90s and she sat in this conversation with us. So there was so much of sharing about affirmation, like encouraging the elder, even though at this last lap, how the sibling come forward to support him in home care. These are really satisfying moments for me personally. So as I share with my doctor, I say sometimes the takeaway every day, it is really the privileged journey that you can sit in meaningful conversation. So why then community and not restructure hospital? Still a bit of Goyo here. Yes, we want to build, personally, I want to build long-term relationship. And I want to make a difference in elder life. Honestly, when I was in restructure hospital, I didn't have much time. It was about meeting the agenda of the hospital, discharge the patient ASAP, and make sure they are out of the system. And that was my KPI then also. And I felt that, wow, really, this is not what I want to do. But in community, it's different. You establish deep and meaningful relationship. And that's where you start to have your client elder coming to you, sharing more in-depth issue with you. And also, I guess it is a relationship that you will treasure, the takeaway, even when you discharge a client into other service providers' care. Like recently, I had one elder, he's a single elder living alone in a group home, senior group home. He is happily demented, I must say. One of the client with cognitive impairment, but no aggression, but full appreciation. And I like to journey with him. And actually, I moved him from a comfort place to a very different environment, living in a group home with another co-tenant. And he himself is also trying to get used to the lifestyle. But this gentleman really touched my life. 2 weeks back, when I talk about advanced care planning with this gentleman, he has no next of kin. His siblings are all in Australia and in New Zealand. Basically, he told me, Jody, you are like my granddaughter walking with me to the post office bank. So I turned back and looked at him. Wow, okay, someone who just addressed me as granddaughter. It's like to these gentlemen, I'm like his next of kin. And he feels that, you know, I'm just like his savior. Very cute elder. He will call me every day, Jody, I need to call you, but I don't know why I need to call you. So every time there was a period of time because he needs a lot of he needs basically help support in his transition. I go down every day to make sure that when he come out from the community home, he's safe in a home, and every day is a new beginning for me and him. He will ask me, do I know you? It's just like I have to repeat to him, oh, I'm Jody, I'm a social worker. Every day is a new day, new beginning for both of us. And I find it really not dull, but it's challenging because it is so interesting to work with these elder. At the end of the day, you know what he saved in his handphone? My name, not Jody, but a savior. I say, wow, what a big name to carry, you know, a savior. So jokingly, I just say, I mean, of course, even if I discharge him to senior group home, I will still visit him there and there as a volunteer, you know. But I don't think he remembered and he registered these statement lah. But I guess the reward at the end of the day is, you know, it's just probably most of you're aware about the starfish story, the moral of the story, how much difference you want to make, you know. So in social work, really, you know, okay, this is my family in St. Luke ElderCare. Yeah, so I hope the takeaway is for today's sharing, you know, so much has been shared. You know, what you do make a difference, but you have to decide what kind of difference you want to make for yourself. Okay, so with this, I end off my sharing. This is my colleague from my department. I have my art therapist, I have my counselor, my social worker. We are a small team in this big organization. So, and together with St. Luke, we want to transform thousands of lives for our elders and our caregiver. So with this, we can bring on to Q&A. Okay. Okay.
Right. Thank you so much, speakers, for your insightful sharing. So we have come to the time of Q&A. So we will actually only cover one question. So all speakers would like for you to actually turn on your cameras at this point in time. And the question we would like to ask is, do you have any words of advice for students who want to enter into the community care setting and also who are interested in your discipline? So let's say for Naomi is to join community nursing, do you have any words of advice for them? So maybe first we can start with Lei Ling and then we proceed to Naomi, Felicia, Christine, then Jody. Thank you.
Sure, word of advice. You have to be really seeking your heart first. If helping others is what you really enjoy. If you hear all our stories, many of us actually already have this in our hearts. Just like Naomi, she's a first aider. I'm from St. John. I'm from Red Cross. You know, when I'm in school, ever since young, I wanted to be in the healthcare helping people. I think, I don't know, I kept hearing people having this intention since at a very early stage of life. But even if you don't have that, I think it doesn't matter. But you really have to ask yourself this question. Is this a sector that helping people is what you want? You won't be earning loads of money. You are capable of making loads of money, but you won't be, because this is healthcare. Yeah. So I think it's really asking yourself the heart. Then this just one more point is it's not an easy journey if you pick up to serve in this sector. You need self-care and you need perseverance. You need to persevere knowing that whatever you do, you are trying to make an impact in somebody's life. I think that is what sustained me all this time. You know, we want to give up at different stage of our life, but we still continue the journey because we really have to do a lot of reflections and how to self-care and also not burn out, but at the same time persevere. Don't give up too early. You need experience to walk this journey. Okay? Yeah.
Naomi?
So for me, I'll be honest, this journey is not for the faint-hearted. Okay, so don't come in and collapse, because we cannot afford to use time to save you when we can save the elders. Okay, Yeah, so for me, it's all about grit and genuine heart. I always feel that grit means, to me, growth, responsibility, integrity, and transparency. Um, this one I won't tell, give one lah. Huh? You cannot find this anywhere, so I'm going to copyright it. Yeah. So I think the genuinity of your heart is very important. Other things like your knowledge, your skills, you can always learn. But if the heart is not there, and if the heart is not pure in wanting to provide care, then that one cannot learn. Very hard to learn. Yeah, it has to be in you, that you want to give to others, so that they can, have as good a journey as you have as a person. So the personhood, mankind personhood, very important. So for me in nursing, it's about that.
Okay. Okay, so for myself, my advice would be, I think it's very important as healthcare professionals for us to pace ourselves. Yeah, so in future, yeah, you should pace yourself. You have to blend selflessness, because a lot of people I keep hearing, they come inside here because they want to do something for the community, do something for somebody else, right? But I have to encourage you all to blend selflessness, balance selflessness with self-love, right? Because we can only give of ourselves and what we have, and we cannot run on empty. Yeah. So, and maybe another word of advice is, no man is an island. So cherish yourself and respect yourself, as well as your fellow colleagues, your fellow AHP or allied healthcare professional warriors, because all of us are in this fight and against all the diseases together and disability together. Yeah, because as you can see today, everybody has something to offer. Everybody has something unique to offer. So yeah, we will only thrive as a team. Thank you.
Okay. Hi. So I was gonna say similar things as what Felicia mentioned. So you need to know how to have self-care and self-love. So self-care in the sense that if you're stressed out, you need to know what makes you, maybe go for a massage or get like pedicure or something that brings you joy. So you need to know yourself quite well. And also you have to be a bit resilient, I would say, because it's not easy, but it's also not too difficult. So you need to know how to deal with it, because at times you won't get all the pleasant of the whole journey. It wouldn't be all roses and like smell great and all that. Yeah, sometimes you get mean elders, like, no, they're just not happy, and you just need to be resilient and take it in your stride and not take it personally as well. And one last thing is also, if you're not sure whether this is suitable for you, just try and see if like, let's say you're out walking around, if you see somebody that needs help, do you have that instinct where you're like, oh, should I step forward and help this person in that way? Like, so, and also you have to be a bit more kaypoh, I would say, because in our job, if we ask a lot of extra questions to find out more about certain things that need help. Yeah, so if you're kaypoh a bit, it's quite okay also, because it's quite good lah. Yeah, so you get to understand a bit better what's going on. Yeah, because it's a very people directed kind of like industry. Yeah. Thank you.
Yep. So for me, the takeaway, the sharing, it is basically the starfish story. I think this resonates with most of us here. We want to make a difference. So even though it is just helping the one person, I think that makes a significant difference in our life and in the elder life or in your client's life. So I guess it is like what my colleagues here have shared. We don't work silo. It is a team effort to make everything work. So why St. Luke? I must say, because St. Luke is an ecosystem by itself. I must sell Goyot now, last 1 minute. So why is St. Luke? Because we are an ecosystem from center base to home base to residential base. And finally, we journey the last leg with the elder in the nursing home. So I guess all spectrum that we cover in St. Luke, it provides so much of opportunity to enrich the life and enabling life of our elder and our caregiver. Thank you.
Thank you all speakers for your very heartfelt and really very warming sharing that we had. Really thank you. And we have come to the end of this session. We hope that you have benefited from their sharing. So if you have enjoyed this session, please take a few seconds to rate this program at the bottom left of your screen. Our next session starts at 2 p.m. So do have a quick lunch. So it will be a part of my community care journey, real life scenarios in the life of an occupational therapist, physiotherapist, medical social worker, and nurse in community care by St. Luke ElderCare. This is an interactive session, so participants will be able to follow an occupational therapist, a physiotherapist, medical social worker, and nurse as they recreate a day in the life of their actual activities at work virtually. So learn how they perform their various roles in the respective healthcare disciplines as they engage in therapy and treatment with their clients. There will also be Q&A sessions with them. So you are able to actually clarify the questions that you may have and we weren't able to address during this session. So we look forward to seeing you at the 2 p.m. session as we will wrap up our healthcare scholarships virtual experience after that session. So go on and have fun as you dare to care in our online webinars and virtual activities. Thank you once again.